Assalamu alaikum. The article for this week is titled with the clinical outcome of non-surgical root canal treatment using a matched single cone obturation technique with a calcium hydroxide based sealer. It's a retrospective analysis done by Dr. Subbiya and his colleagues from India, published in 2022 in Journal of Endodontics. Matched single cone obturation is an uncompaction technique which uses a single Getaperca cone that will match the size and taper of the master file, which can provide adequate adaptation of the filling material with root canal morphology. Fill interfacial gaps between the Getaperca cone and root canal wall can be achieved by using a sealer, and it's important to prevent reinfection of a treated root canal. Silapix is a calcium hydroxide based sealer having favorable properties such as biocompatibility, good antimicrobial activity, flowability, radiopacity, and good adaptation with acceptable dimensional changes. So the aim of this retrospective study was to determine the outcome of non-surgical root canal treatment using Silapix and matched single cone, and also to identify the various prognostic factors influencing the outcomes. 272 patients received endodontic treatment from 2013 to 2018 were included in this study, and the inclusion criteria were patients who required root canal treatment due to symptomatic and asymptomatic pulpitis or pulpal necrosis with or without symptomatic or asymptomatic apical periodontitis or acute and chronic apical abscess. Also, the treatment should be primary root canal treatment and root canal filling with matched single cone and Silapix sealer, and during recall, tooth must have intact coronal restorations. Patients with uncontrolled diabetes, immunosuppressive conditions, immunosuppressive medications, pregnant women, and poor oral hygiene were excluded from this study, and teeth were excluded if they with periapical lesion greater than 5 mm or required surgical endodontic treatment, or the teeth have cracked and periodontal pocket more than 5 mm. A total number of 223 patients with 261 teeth reported for recall, with a recall rate 81%. Root canal treatments were performed following the standard endodontic treatment protocol. Regarding the clinical and radiographic evaluation, the patient's age, gender, and tooth involved, pulp vitality status, presence of intra or extraoral sinus, single and multi-visit treatment, number of the roots, and the preoperative and immediate postoperative radiograph were recorded. And at the recall visit, the recall ranging from 24 to 84 months, assessment of the tooth was done, which included the presence or absence of pain, tenderness to percussion palpation, swelling, sinus tract in relation to the tooth, and the recall visit radiograph, BAI score, and the presence or absence of excluded sealer were recorded. The treatment outcome were categorized as healed or non-healed or healing. Healed if the tooth is functional, asymptomatic tooth with BAI score 1 on radiograph, and non-healed if it's non-functional, symptomatic tooth with persistent periapical pathology or increase in BI score compared with the preoperative radiograph, and it's considered to be healing if the tooth that are asymptomatic and functional with a decrease in the BAI score from preoperative score. Healed and healing cases were considered success treatment, and non-healed cases considered to be as failure. The results showed that the overall success rate was found to be 89.7%. Only three prognostic factors were found to be statistically significant, which are age, number of roots, and preoperative pulpal sensibility. And while the initial PAI scores and the presence of preoperative sinus tract and number of visits and ciliar extrusion did not affect the outcome, and the initial PAI score had influence on the ciliar extrusion, which was more common in teeth with the higher PAI score. And based on the result, they concluded that 89% success rate was achieved by using matched single cone with syllabix and completely restored of extruded syllabix after 2 years, and it was not effect on the outcome.